Well, good evening, and welcome to everybody for 2022, our first meeting. And what we will do is we are going to start off by electing a chairperson. And I just want to let you know that the executive team is here so that when we go to the point where we will be discussing the budget and answering questions, we have all the experts around the table. We'll also be going in camera for part of the session. So we'll start off, first of all, with the election of the chairperson for the Property and Finance Committee. And we have nomination by Gary Gunther of and seconded by Dave Budeye to have Dan Rovita be elected chairperson of the Finance and Property Committee for the North Bay Prairie Sound District Health Unit for the year 2022. So I'm just going to go through the list of people for and against. Dean Backer. Dean, are you on? Okay. Dave Budeye.
Yes.
Blair Flowers.
Yes.
Gary Gunther, you're on.
Yes.
Nancy.
Yes.
Stuart.
Yes.
Is Jamie McGarvey on? Scott Robertson.
Yes, I'm here. I support Dan as chair.
Okay. And Dan, you'll vote for yourself, I think.
Yes, yeah.
Oh, good. Always appropriate. Mary Ann, are you on?
Yes.
Thank you.
I say yes.
And Tanya, are you on?
Yep, I'm here.
Okay. Are you for?
I just got on, so am I for the agenda?
It's it's we're just electing the chairperson, and it's Dan Rovita to be chair, and Gary Gunther moved it and seconded by Dave Budeye.
Yep, absolutely moved.
Okay, thank you very much. So it's carried, and I'll turn it over to Dan if he's not having any issues with the internet.
No, I'm not. Thank you, Dr. Chairco. It's moved by Mary Ann Strickland, seconded by Dave Budeye, that Scott Robertson be elected Vice Chairman of the Finance and Property Committee for the North Bay Prairie Sound and Health Unit for the year 2022. Dean Backer. Dave.
Yes.
Blair.
Yes.
Gary.
Yes.
Nancy.
Yes.
Stuart.
Yes.
Jamie's not on. Scott Robertson.
Yep, I accept the nomination. Thank you.
Myself, yes. Mary Ann Strickland.
Yes.
And Tanya.
Yes.
So it's carried. Congratulations, Mr. Robertson. So moving forward, we have the approval of the agenda. At the finance, moved by Janie McCarthy. Oh, so it won't be by Janie. It'll be moved by Dave Bunty and seconded by Scott Robertson. That the Finance and Property Committee agenda dated January 26, 2022 be approved as presented. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy?
Yes.
Stuart?
Yes.
Jamie's not on. Scott?
Yes.
Myself, yes. Mary Ann Strickland?
Yes.
And Tanya?
Yes.
So it's been carried. So if anybody has any declaration of conflict of interest, please do so and we'll record it. None? We'll move forward. Approval for previous minutes. The first one is Moved by Nancy and seconded by Tanya, that the minutes from the Finance and Property Committee meeting held on October 27, 2021 be approved as presented. Dave,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy,
Yes.
Stuart,
Yes.
Scott Robertson,
Yes.
myself, yes. Mary Ann
Yes.
and Tanya.
Yes.
Carried. Page. Moved by Mary Ann and seconded by Stuart. Be it resolved that the minutes from the Finance Property Committee in camera meeting held on October 27, 2021 be approved as presented. No, Dean's not here. Dave,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy,
Yes.
Stuart,
Yes.
Scott,
Yes.
myself, yes. Mary Ann,
Yes.
Tanya.
Yes.
Carried. Very good. Date of next meeting, date to be determined, time to be determined, location to be determined. That's pretty good. 7-0, business arising, in camera. Be it moved by Stuart and seconded by Nancy. Be it resolved that the Finance and Property move into camera at 5:07 p.m. to discuss agenda item 8.1, labor relations or employee negotiation. Dave,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy,
Yes.
Stuart,
Yes.
Scott,
Yes.
myself, yes. Mary Ann
Yes.
and Tanya.
Yes.
Perfect. So,
Okay, 1 minute to allow us.
you. Dave,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy,
Yes.
Stuart,
Yes.
Jamie,
Yes.
Scott,
Yes.
yes for me, Marianne,
Yes.
and Tanya.
Yes.
And
Yep.
okay, thank you. Okay. We'll move on to 9.0, new business, operational plan and financial budget proposal 2022. Adam.
Thank you. I'd like to present this year's budget for your consideration. This budget is a 2.33% increase in the expenses, which translates to a 3.28% increase in the levy. The difference in those percentages is because we, in preparing this, we did not adjust the mitigation funding because at this point we have approved mitigation funding for 2022 that is based on the same amount we've been getting for, this would be the third year. So there is no indication from the province that they will actually increase the mitigation funding if we get an increase in the budget. They did, the only indication we've gotten from the province about budget increases is to say that they are going to allow us to submit for one. So in the last 2 years, they have not allowed a submission for an increase, but this year they are allowing for it. So just to refresh your memory, though, on a few things that are causing the increase. The increase is due to some significant benefit increases, WSIB of 17.5%, EI of over 7%, Canada Pension of over 10%, and salary increases per negotiations. And insurance premiums have gone up by over 4%, and utilities over 11%. And the addition of the one position that we talked about in camera is also a significant item. This budget does not include requests for 100% funding for COVID. We just did not have time to get those budgets ready in time to bring them here. They are have been in the last 2 years 100% funded items, and they're the next 2 weeks job because they're going to be due before the end of February. But similar to last year, we will be developing a budget for immunization, COVID immunization, and COVID general expenses, and some recovery budget for some extra staff to try and get back to the work that hasn't been done in the last couple of years. So those, on your behalf, we will be submitting for those things within the annual service plan when we get it. We still haven't got the form, but they do say it's due in about 3 weeks. So, so other than that, I think I've covered most of the points that I had about the document, but I can certainly entertain any questions that anyone has.
Questions, comments? Well, Isabel, from the municipality's perspective, you said the levy to the municipalities is going to be 3.2%?
Yeah, about 3.3%. It's just 3.28.
Okay. And then if we do get in our request for 100% funding for COVID-related expenses, how will you fit that into the budget? Like, it's
okay, so yeah. So right now, how the province has been dealing with COVID funding, we have to spend all our cost shared money before they flow any 100% funding. So right now we're doing the fourth quarter report. We add up all the expenses of the health unit. We subtract off mandatory program funding, and then we start subtracting the COVID funding we received. And it looks like they're still going to owe us another $100,000 or something in the next at the end of the year. But we do have to put in a budget of what we think it's going to cost. I don't really know why, because they flowed the money based on the quarterly reports of what we previously spent pretty much. But we did apply for 4.3 million last year, and it looks like the expenses are going to come in about 4.1 or 4.2, somewhere in there. So my guesstimate was pretty close, considering I had no clue what was happening this year. But anyway, sometimes better luck than judgment, I think. But anyway, that's what the process will be. Again, we'll submit something we think might be a plan, and then they'll proceed to get quarterly reports, and it just allows them to have some notion of what money they should be setting aside for this as the time goes by.
Good.
I just wanted to add. Oops. I just wanted to add that that's better. If you recall, in previous years, we had unexpended dollars. Well, because of what Isabel just said, that there won't be any unexpended dollars. We have to spend all of that money first before we can apply to get that 100%.
Got it. Okay, thank you. Is there any other questions or comments? So, it's moved by Scott and seconded by Jamie. Be it resolved that the Finance and Property Committee recommends that the Board of Health, the North Bay Parry Sound District Health Unit, approve the 2022 Board of Health Public Health budget as presented, with a total shareable base of $22,309,044. Dave?
Yes.
Claire?
Yes.
Gary?
Yes.
Nancy?
Yes.
Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes, great job, Isabel. Thank you.
Myself, yes. Marianne?
Yes. Thanks, Isabel.
Tanya?
Yes.
Great job, Madame. So now we'll move forward. It's carried.
Thank you.
The lending agreement, who will talk to that?
Me, I guess.
Oh, great.
So you may recall that last June, I believe, we increased our overdraft protection up to 1.5 million, and we came in midsummer very close to reaching that amount of overdraft. So this year, with the election and various things happening where the government will be shut down for a while, I felt we should revisit this. The previous one was only temporary for 6 months, and I tried to get a temporary one for 1 year, and the bank doesn't do them temporary for that length of time. So, but we can, they're working on one for what they're calling a permanent credit facility, and then at any point in time later, we can ask to have it reduced. So if we get back to something normal, whatever that is, then we can adjust it to what works better for the organization. Up until COVID, we had 500,000 for years and we never used it. But now the time between funding and the rate at which the cost is, like this, for an example, this biweekly pay right now is $500,000 just for the pay without the benefits that have to be submitted on that. So it's probably closer to 750 or something like that. That has to come out of the bank all at once. So I felt that just to be safe, and the province doesn't really entertain advancing us funds unless we've extended as much credit as we can. They'd like to spread the credit around the province, I guess. They are covering the extra interest on the loan as part of COVID expenses. So this just brings our credit overdraft limit up to $2 million. They did ask to use the mortgage that we have. There is actually no balance on the mortgage that we have on the building, but we have left it registered on the mortgage. It's just it was a way in case at any point in time that we needed it, like right now. We don't have to go through the whole process of getting evaluated for a mortgage. It's left there as a lien against the building. So that is part of the resolution.
Thank you. Are there any questions? So this is basically just good business in the sense that you're increasing the credit line for us, and then but the province is paying for the extra interest, so that's a good thing.
Yeah.
Dr. Chirko, did you want to make a comment?
Just wanted to say that I know other health units have had some difficulty with cash flow issues. So this is really just being proactive, and that there are certainly, just so that you know, there are safeguards in place that I just can't go in and write a check. There are safeguards that, and double checks to make sure that it's all done appropriately.
Excellent. Thank you. So, moved by Tanya, seconded by Nancy. Do I have to read the whole thing, Sherry?
Just the therefore.
Therefore, be it resolved that the Finance and Property Committee recommends that the Board of Health for the North Bay Prairie Sound District Health Unit approve the permanent lending agreement increase of $1.5 million with RBC, and furthermore, be it resolved that the Finance and Property Committee recommends that the Board of Health approve the use of the collateral mortgage in support of the line of credit. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy?
Yes.
Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Myself, yes. Marianne?
Yes.
And Tanya?
Yes.
Very good. Now we move to the adjournment. That's it. I'm done.
Thank you, everyone.
Good job.
Yep.
Thank you. We okay to go into the next
Dr.
meeting now?
Chirko, you don't need me for the rest, right?
I don't believe so.
Okay, thank you. Good night.
Thank you.
Good night,
Night.
Isabel. Thanks.
Night.
So we'll call the meeting to order for the Board of Health. And the first order of business is to elect a chairperson. And we've already had a mover and a seconder for electing Nancy Jacko as the board chair, and moved by Gary Gunther, seconded by Dave Budai. And I'll just read now, therefore be it resolved that the Board of Health approves a one-year extension to the chairperson's term of office and appoints Nancy Jacko as chairperson of the Board of Health for the North Bay Prairie Sound District Health Unit for the year 2022. Dean Backer is not on yet, or he's not going to be able to make, okay. Dave Budai?
Yes.
Blair Flowers?
Yes.
Gary Gunther?
Yes.
Nancy?
Yes, and I accept. Thank you for your faith in me, gang.
Stuart?
Wholeheartedly, yes.
Thanks, Stuart. Jamie?
Yes.
Scott?
Yes.
Dan?
Yes.
Marianne?
Yes. Thank you, Nancy.
And Tanya?
Yes.
carried. And I'll turn it over to our chairperson. Thank you so much for your dedication to take this on again. And hopefully COVID will be over by the time
It comes around.
it comes around.
I figure
again.
I don't know what's gonna last longer, COVID or me, but one of those. Might as well stay with it another year while we're into it. Thank you for your confidence in me, and I'm gonna move on next to the election of a vice chairperson. And I have a motion duly moved by Mary Ann Strickland and seconded by Dave. Be it resolved that Stuart Kidd be elected vice chairperson of the Board of Health for the year 2022. And I'm going to call the vote. Dean isn't here, so Dave,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy, yes, Stuart,
Yes, with gratitude. Thank you, folks.
Jamie,
Yes.
Scott,
Yes.
Dan,
Yes, ma'am.
and Mary Ann,
Yes. Thank you, Stuart.
and Tanya.
Thank you.
Yes. And so it's carried. Thank you. And we'll have, next is the approval of the agenda. Or did anybody have any additions to the agenda before we move it? Hearing none, it's been duly moved by Stuart and seconded by Mary Ann. Be it resolved that the Board of Health agenda dated January 26, 2022 be approved. I'll call for the vote. Dave,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy, yes, Stuart,
Yes.
Jamie,
Yes.
Scott,
Yes.
Dan,
Yes.
Mary Ann,
Yes.
and Tanya. Yes. Thank you. Again, we're off to 4.0, conflict of interest declaration. Again, during any time during this meeting, if you feel you have a conflict of interest on any of the items that we are going to discuss, please feel free to declare them. Off to 5.0, approval of the previous minutes of the Board of Health of November 24th. We have a notice of motion here, duly moved by Tanya and seconded by Scott. Be it resolved that the minutes from the Board of Health meeting held on November 24th, 2021 be approved as presented. Did anyone notice before we go forward, I guess, to do the moving, if there were any errors or omissions in there before we go on to move it? Otherwise, then we'll move forward and call the vote. Dave,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy? Yes, sorry, Stuart. I'm waiting for myself to respond. Oy, oy, oy. That's really bad, Stuart.
Can we re-vote on that, chairperson?
I think so. Sheesh.
Yes.
Oh, God. Oh, my goodness. Jamie?
Yes.
Scott?
Yes.
Dan?
Yes.
Mary Ann?
Yes.
Tanya?
Yes.
Oh, my gosh. That's pretty scary. Okay, and so the motion is carried. And we're off to the next meeting date. And it is scheduled for, when I guess we don't, oh yeah, we do have a motion, don't we? Yeah, I'm trying to just find it here. I'm really having a few little blurps here, obviously, today. You can tell I'm not in the groove yet. Okay, we have a motion. Here, I'm pulling it up. Okay. It's been duly moved by Jamie and seconded by Stuart. Be it resolved that in accordance with the Board of Health Bylaw, Section 2, Number 18, the Board of Health approved the regular meeting schedule for the year 2022 as follows. And it is listed here. Does anyone have any questions regarding that before we move forward? And there's a furthermore, be it resolved that during non-COVID-19 times, the Board of Health meetings are held at the North Bay Parry Sound District Health Unit main office in North Bay, with the exception of one meeting that will be held in the Parry Sound office if possible. The Parry Sound meeting is yet to be determined. So with that, I will call the vote. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy, yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Dan?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
So the motion is carried. Okay, so for the date, 2020. I'm just going to fill out some. Okay, all right. Next, we have an appointment of the standing committees for 2022. Is the next business item, number 7. And we have a motion here, duly moved by Marianne and seconded by Tanya. Be it resolved that the Board of Health for the North Bay Parry Sound District Health Unit approves the appointment of the following Board of Health standing committees for 2022. Number 1, a Finance and Property Committee comprised of all board members to deal with matters of finance, banking, insurance, property, and financial policies of the Board of Health. And 2, a Personnel Policy, Labor, Employee Relations Committee comprised of all board members to deal with matters related to collective agreements, unions, and employment policies, non-union, and personnel policies of the Board of Health. Excuse me. So with that, I'll call the vote. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy? Oh, again, yes. Boy, I'm having blurbs. I don't know who I am today. Stuart?
You did it again.
Yes.
I know.
Yes.
Wow.
We're gonna get to some aspirin.
I know. I need 2022 obviously is not a good start for me. Stuart?
Yes, I'm good.
Jamie?
Yeah.
Sorry about that. Scott?
Yes.
Dan?
Yes. Yes.
Marianne?
Yes.
And Tanya?
Yes.
And so it's carried. Holy smokes.
Once more and you're out.
I know, 3 strikes and wow, I don't know what's going on here. I'm in some fog today. Okay, so we have our next resolution for our 8.0 on our agenda is the appointment of the signing officers for 2022. And and I don't know, you might change your mind if there is anyone wants discussion after what I've done. So we have a motion duly moved by Scott and seconded by Jamie. Be it resolved that the Board of Health for the North Bay Parry Sound District Health Unit approve the signing officers for the year 2022 as follows. Board of Health Chairperson, which would be myself, and Board of Health Vice Chairperson, who would be Stuart. Medical Officer of Health, Dr. Cherko. Executive Director of Clinical Services and Chief Nursing Officer Shannon Mansa, Executive Director Community Services Louise Gagne, Executive Director Corporate Services and Privacy Officer Paul Massacott, Executive Director of Finance Isabel Churcher, and Executive Director of Human Resources Jose Goulet. So I will call the vote. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy? Yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Dan?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
So that's duly carried. Thank you. And then we're off to the appointment. Next motion is our next item on the agenda is appointment of legal advisor for 2022, and we have a notice of motion for that. Duly moved by Stuart Kidd and seconded by Mary Ann. Be it resolved that the Board of Health for the North Bay Parry Sound District Health Unit approve appointment of the following legal advisors for the year 2022. Under the corporate legal advisors, we have the Corporation of the City of North Bay, Lucenti Orlando's and Ellies, Frank Williams and Associates. Under enforcement legal advisors, we have Joseph B. Kennedy and also the Corporation of the City of North Bay. For Health Protection and Promotion Act, which is the HPPA, legal advisors are Joseph Kennedy and Milbro and Stevens and Larmer Stickland. And under the Labor Relations legal advisors would be Filion, Wakely, Thorpe, Angeletti, LLP. And furthermore, be it resolved that the North Bay Parry Sound District Health Unit may use additional legal advisors as directed by the Medical Officer of Health, Executive Officer, and approved by resolution at the next regular Board of Health meeting. So I am going to call that to a vote, and so we'll go through Dave Budeye,
Yes.
Blair,
Yes.
Gary,
Yes.
Nancy, yes, Stuart,
Yes.
Jamie,
Yes.
Scott,
Yes.
Dan,
Yes.
Mary Ann,
Yes.
and Tanya.
Yes.
And so the motion is carried. Now we're on to business arising. Does anyone have any business arising from the last minute? Hearing none, we'll go on to 11. Item 11 on the agenda, report of the Medical Officer of Health. So over to you, Dr. Chirko.
Thank you very much, Ness. So what I thought I'd do is I'll give a little bit of an update and start with certainly the issues that we've been having most recently. And we know that certainly with the Omicron, it's been a widespread community transmission. And so that really changes what the testing has been available. It's been more targeted. The case numbers that are reported certainly are an underestimate of the actual community infections. And that may be in the order of anywhere from 2 to 4 times greater than what's being reported. The health unit still has had the lowest case rate per 100,000 in the province. And there was a real shift in strategy from containment to really mitigate harms and through vaccinations and public health measures. And the reason is that we have to focus on really protecting the most vulnerable in the higher risk settings and preventing the healthcare system from becoming overwhelmed. And so in doing that, the indicators certainly have changed as well. When it used to be absolute case numbers, we've now shifted to more relevant indicators being hospitalizations, ICU admissions, deaths, and percent positivity rates have been somewhat helpful too. Now, this past week in the provinces, we've seen a bit of a stabilization or plateauing of hospitalizations up around the 4,000 number. However, the COVID-related critical illness has still been increasing in Ontario and in the north, but the daily trend in the critical care occupancy rates remains, so it's still less than 85% overall, certainly in Ontario. There are some hospitals that are seeing surges, but that trend is similar for pediatrics as well. However, very tragically, deaths are on the increase. There is some lag in reporting, which you have to certainly keep in mind. But before this wave, it was the first wave that really saw the largest number of deaths. And there is some prediction that potentially there could be more deaths. And the best way, certainly, to prevent that is to the immunizations, especially in the targeted high-risk settings and individuals, and those being the elderly and especially unvaccinated. So that is really our focus. Now, what we're seeing throughout the province and locally is that there's been a lot of community outbreaks, mostly in congregate care settings and living settings, such as long-term care homes, retirement homes, hospitals, group homes, shelters, corrections. That's where most of the efforts are certainly being identified to work on. And locally, we've had 3 hospitalized cases. We've updated, and I'll mention it later, our website with some explanation and more clarity on hospitalizations that are being reported. We have 209 active cases. Our positivity rate is about 15%. We've sadly had 13 deaths and some recent, and we're dealing with 11 outbreaks currently. Case and contact management also had to be strategized and reevaluated because there simply was not the capacity. It would be very similar to trying to do case and contact management in a normal flu season where you have so many cases that really it is impossible to do. And you'd be in a situation where people know what they have to do when they do get the flu. Similarly, now there is individuals have responsibility to initiate public health measures to prevent further transmission in the community. So that includes like a timely self-isolation, staying home when you're ill and away from work when you're ill, and the 2-meter physical distancing, masking, all those things that you need to do. People are taking that responsibility, and they're doing very, very well at that because we certainly, while there are pressures on healthcare, we haven't been overrun, and we really want to congratulate everyone for the work that each individual does to adhere to these measures and to keep us all safe. As far as testing goes, again, prioritization of testing became imperative because of capacity and to maximize the use of limited resources. The health unit website really lists a lot of indications for testing. If you have questions, you can start there. More than happy to have you call into the health unit to ask if you have any unanswered questions. And it's for symptomatic and asymptomatic individuals. A lot of the information is there, and the type of test that may be most appropriate. Certainly, we know vaccinations continue to be highly effective in preventing severe illness, hospitalizations, and death, and still reductions associated with at least 2 doses for infection is about 56%. Hospitalizations, the reduction associated with at least 2 doses is like 83%. And for ICU admissions, 91%. So we're still seeing them to be very, very effective preventing severe illness. So when you have the immunizations plus the public health measures, that's giving us the best protection possible. We continue to prioritize 1st, 2nd, 3rd, and even 4th doses. The 4th doses in congregate care settings, long-term care, retirement home, elder care. Really, we believe that we'll have it completed by the end of January to provide further protection. They're the highest risk individuals for sure. We're also doing school-based clinics after hours, evenings, and on weekends to best meet the needs of the children and their parents. The recent one that we had was at Woodlands, and it was very successful. We had booked appointments as well as walk-ins, and got very favorable feedback on it. There are some recent, as of today, I believe, or yesterday, NACI came out with a statement on 5 to 11-year-olds and with recommendations to a series. And so I won't go through it all right now, but certainly is there if anybody's interested, and we can answer questions with that. Our website has been updated to display information that is more current and relevant for what public may be interested in based on the change in the indicators too. I also want to mention too, on behalf of North Bay Regional Health Center, that they have a COVID-19 assessment clinic which they've activated. Now, the aim of this is, and the clinic itself is co-located with the main testing center at North Bay Regional, and is available to see COVID-19 suspected or positive patients with moderate symptoms of COVID-19. So what do we mean by that? So if somebody has some shortness of breath, fever, worsening uncontrolled cough, and patients at high risk of complications, or those having difficulty coping with their symptoms, they're also welcomed to the clinic. Mild symptoms are suggested to be managed at home, whereas severe symptoms, especially with any significant breathing issues, you're directed to attend the emergency room or to call 911 if you feel it's appropriate. And the number that they give us for the hospital, you can call 705-474-8600, extension 4110 to book an appointment. And patients should call themselves, the individual, for an appointment. And the appointments are booked for the same or the next day. So this is a real added benefit, and we really thank all of those involved at the health center for this type of service that can really help alleviate having to use the emergency room, and if the need be, they will redirect you if they feel that you need to have more tests or treatments. So it's really a welcomed addition to managing this Omicron, certainly variant. So at that, Dr. Simlay, do you have anything that you'd wish to say or add to it?
No, not. Thank you, Dr. Chairco.
Okay. So I'd be happy to take any questions.
I have a question, Tanya.
Go ahead, Tanya.
Okay. I guess I'm just curious about the schools. So I guess because they report, I guess, their absences online, but do we truly know, I guess, if there's an outbreak in the schools?
No, that's correct. They're looking at possibilities right now of some type of reporting, but that's up to sort of the Ministry of Education. Public Health does not really dismiss cohorts or school closures. Any dismissing of cohorts or closures of schools would be on an operational level that the school would determine.
Okay, thanks.
Are there any other questions of Dr. Chairco?
I think Dan's got his hand up.
Oh, Dan, sorry, I can't see. Dan?
You're on mute, Dan.
Yes. Today I got a phone call from, I guess it's the Chief Medical Officer of Ontario. It's a tape saying that, there's a number of vacancies, there's a fair amount of appointments that are available for the booster shot. Are you aware that they're doing this to all those that haven't gotten their booster, but that they had their 2 shots? Is that why they're doing it?
Yeah, they're really trying to, they know that the booster shots have been very, very helpful, and especially in those that are at higher risk. And so the call out is really to try to get people to get the booster shot, because we know that it really helps to prevent severe disease, hospitalizations, and deaths. And so that's why there's the call out, because we still want to try to get as many people vaccinated as possible, for sure.
And I can say, just as a follow-up, I can really say that I appreciated the call because I guess through negligence, I haven't booked mine yet, but so it's good. It basically got you thinking about it.
Yeah,
I appreciate
exactly.
the call.
Great, thank you.
Anyone else have a question? I'm not seeing hands up, but jump in if you do. Okay, well, with that, we'll move on. Thank you very much, Dr. Chirko, and I know how busy it's been and how difficult it must be to keep up with all the changes. And I think the other thing that's difficult is there's so many different things, such as education being involved with the schools, somebody else being involved with this child, and people, that's part of the confusion that people have. They keep thinking that we're in charge of absolutely everything. Yes, we're consultants for some of these things, but ultimately not always in charge of everything. So, but if you have questions along the line, they're always appreciated. And Scott just had one the other day. I won't go into it, but I hope we've satisfied your answer. So I know Sherry's really good to get to the COVID team if things come forward and try providing answers for someone, any board members that may have things that they have questions about, or from people approaching them as a board member of the board. So keep them coming. Okay, the board committee report. We just had a finance and committee, property committee meeting, and we have a notice of motion from there. We have a resolution that's been duly moved by Jamie McGarvey and seconded by Scott Robertson. Be it resolved that on the recommendation of the Finance and Property Committee, that the Board of Health for North Bay Parry Sound District Health Unit approve the 2022 Board of Health Public Health budget as presented, with a shareable base of $22,309,044. We'll call the vote. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy, yes. Stuart?
Yes.
Jamie?
Yes, and I just wanted to say that I really appreciated how the budget was laid out by departments, so that you could see where the money was going and that sort of thing. Very, very much appreciated. So thanks to the team.
Great. Thank you, Jamie, for that comment. Scott?
Yes, I support it.
Dan?
Yes.
Marianne?
Yes.
Tanya?
Yes.
And with that, that motion is carried. I'd like to also, I really like the fact that we can get our questions in and they can get answered, so everyone can see the questions that are asked from the board members, so there's clarity if there's something you don't understand. It just makes it more efficient, and if it isn't clear enough for you, you have another opportunity to further your question. Okay, so with that, we also had under our next item is 13.0 correspondence, and there was a listing of all the correspondence in your package that we had received or sent out ourselves. Oh yes, I'm sorry. Before I move on to that, we do have a second motion from the Finance and Property Committee. I will bring that back. Sorry, I'm really, it's kind of a rough day for me here. Okay, so we have a resolution put forward by Jamie McGarvey and moved by Jamie McGarvey and seconded by Stuart Kidd. And I'm going to not go through the big whereases, but therefore be it resolved that the recommendation of the Finance and Property Committee that the Board of Health for the North Bay Parry Sound District Health Unit approve the permanent lending agreement increase of $1,500,000 with RBC, and furthermore be it resolved that on the recommendation of the Finance and Property Committee that the Board of Health approve the use of the collateral mortgage in support of the line of credit. So with that, I'm going to call the vote. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy? Yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Dan?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
And with that, the motion is carried. Thank you. So thank you very much for pointing that out, Sherry. Okay, so now we are on to 13 correspondence, and as I said, it was included in the package. And I just wanted to make note of the last item on the correspondence, that we, in fact, with Sherry's help, we drafted a letter to go to Andrea McClellan, thanking her for staying on with us after her retirement and really piloting the whole beginning and the rudiments of setting up our clinics. But I just wanted all of you to be aware that it went to her, and I think she greatly appreciated it. And we appreciated her, that's for sure. And she's working diligently at the clinics. Under new business, 14.1 is corporate sponsorships and donations 2021, a report to the board. So is there any comment on that? No. Request for proposals, 2021, report to the board, anything there? No. Okay, we do have a resolution here for the Association of the Local Public Health Agencies Alpha Winter Symposium registration. Again, this is for our association that in many ways represents us. There's a motion here that has been duly moved by Mary Ann and seconded by Tanya. Therefore, be it resolved that the Board of Health of the North Bay Parry Sound District Health Unit authorizes, and we usually have up to 2 people, Board of Health members, to attend the Association of Local Public Health Agencies Alpha 2022 Winter Symposium to be held virtually on Friday the 25th, 2022. And furthermore, be it resolved that expenses related to the attendance of the Alpha 2022 Winter Symposium be paid in accordance with the Board of Health Remuneration Policy BF 004. And before we call the vote on that, I just, you can think about it, and if you're interested, if there are any people coming forward who are interested in going, or attending it, it'll be virtual, and it's usually very informative, keeps you up to date on different things, and gives you an opportunity to ask questions and get a sense of what's going on across the other health units. Be free to express your interest in attending. And can you let Sherry know if you are interested in attending? But be prepared, it is a good chunk of a day. So with that, I'm going to call the vote for that resolution. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy? Yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Dan?
Yes.
Marianne?
Yes.
And Tanya?
Yes.
And with that, the motion is carried. Then we had in your package a quality issue report for 2021. And I don't know if Dr. Cherko wants to make any comments so people understand how this quality assurance report works.
I won't go through the whole report, other than to say that we use it as a quality assurance, where if there's any type of complication or problem that has arisen, we categorize it into different levels. And level 0 being sort of like a near miss, no harm, loss or damage, documented, and all the way up to severe injury or problem, which we didn't have any of those. So we get these reports routinely done, and they're meant to assess a situation and learn from it and feedback to the staff, as well as at our level, because one thing I've learned over the years is that when there are significant issues, it's not just an individual's fault. It's usually related to the system. And we need to address the system issues as well as if there were any individual mistakes that were made. But very often it is a system problem that we want to identify and learn from. And we feel that this is just how to become a better organization by finding out what issues we've had and how we dealt with them and how we can better deal with them in the future. So that's what the report is about. And if anybody has any interest, you can give me a call as far as if you wish to know what kind, and because it is quite lengthy.
Can I ask two questions? Well, one comment is, of course, that you want to get the no blame, no shame, so people are not
Yes.
afraid to report. So
Yes,
they need to look at it as a quality and process improvement. The second thing is, I just wanted to know if there were any issues that came out of the clinics that would be included in this, or is it, so it would be even from our vaccine clinic, if something occurred would be in there as well. So it's not just other stuff, it's everything.
Yeah, absolutely. I mean, if we make an error or there's a problem, it gets addressed here so that we can ensure that we pick it up and we fix it. And we're very open and transparent about those kinds of certainly issues. Mistakes happen, and we need to acknowledge them, learn from them, and ensure that we do everything we possibly can to prevent it from happening in the future.
Great. Does anybody have any questions regarding the quality issue report or about the whole quality program in any way? Okay, hearing none. We have 15 on our agenda. Number 15 is in camera, and I don't believe we have anything for in camera. And number 16 is adjournment. So welcome everyone
Madam
to
Chair.
20. Yes?
It's Stuart
Yes?
here. Before we leave, I'd like to say thanks for the media conferences on Thursdays. I think they've been very effective. I hope the media does too. In fact, I have a confession that I signed in a wee bit late last time, and I was confused because I couldn't get in. You guys were already done. So I think it's answering the question, and I'm glad to hear that. But I'd also like to say thanks to Nancy for being at the clinics and working there too. I know it's been beneficial and well received. Thanks, folks.
Thank you. It's though I listen in, and if for some reason I always listen to the tape one, but if I'm not on, one of us, Stuart or I, is always on, so we're back and forth online if we have, did I hear that right, or did you understand it the way I understood it, or something like that? So I have found them really, really helpful, because you would not believe the number of questions you get asked by the public. And I always feel I've got a little bit of a foot forward if I've listened to that. So I appreciate it. And I feel they're going so slick, and everybody's doing such a good job. Carol, your job, answering questions, and that aren't always easy questions to answer, and trying to have all the information at your fingertips. And if not, you get back to people, and that's what's most important. So I agree, Stuart. I'm with you on that all the way.
Well, thank you, and I'll pass it along to the staff.
And
a lot of work goes into it, and preparation and communications, IT, everybody, the executive team, everybody really works hard to try to answer as many questions as we can.
And I went to, and one last question I had, or one last comment I wanted to bring forward was really interesting. We have personal friends who have a cottage in South River who they've spent all of COVID at. They're originally from Brampton, so you can well imagine why there was such an outbreak there. Anyway, they could not get a booster vaccine down there for a long period of time. And so they contacted me and asked, is there a possibility that there might be a clinic opening here? And just then, it was just before Christmas when we released that whole bunch of new clinics. They called, and I said, call in right now. I said, I know we take all here, whereas I know some other health units will not take anyone without an address in that area. And yet these people live and pay taxes in South River, so they would be kind of a resident. They got in the next day, and they were so impressed with the clinic, how polite everybody was, how efficient everything was, and how I'm so thankful that they were able to get in, because it would have been weeks and weeks before they got their booster, and they're seniors. So I wanted that to be said to the staff, how impressed they were with North Bay.
That's very nice. Thank you for the feedback, and
Yeah.
certainly pass it along.
And with that, adjournment. So see you all again at the next meeting. And if there's anything else that comes up that's urgent, I'm sure there'll be one at the call of the chair or the medical officer of health. Have a good evening, everybody.
Good night.
Thank you.
Bye.